Today on the Dr. Oz Show.
Now, the next big pain is back pain. Give me a show of hands. How many of you have thrown your back out, quote unquote? You ever wonder why your back seizes up and the next thing you know, you're flat on your back? So Dr. Vonda Wright is an orthopedic surgeon at the University of Pittsburgh Medical Center. Welcome to the show.
Thank you for having me.
So share with everybody your thoughts on why we throw our backs out so readily, because everyone put their hands up when I asked.
You know, Dr. Oz, many of us sit at a desk all day behind a computer, or we slouch at home when we're watching TV, and that actually gives us tight muscles in the front of our legs. But more importantly, it weakens our cores and our backs, and it's all of those things together that gives us the pain that is so debilitating.
So everyone's sitting up straight now. You don't want any of that happening.
Posture.
Everyone at home, same thing, posture. All right, so give me an exercise folks can do that's sort of simple and easy. They can at least get their backs in good enough shape to avoid throwing them out.
I like people to do wall squats or partner squats because they strengthen many muscles at once. So I'll show you if you have someone to show us with.
Michelle, she's sitting close to the front up here. Come on up.
So what you do is you choose a surface like a wall or a friend, and you put your backs together.
We're about the same height. That's good.
Yeah, it's perfect. Backs together.
You pick someone tall.
I want you to go down about 60 degrees. You're leaning against each other. This is strengthening.
Help me.
This is strengthening their legs, their cores, and their rear ends all at the same time. You can come up,
come on,
guys.
keep going. All right, come on,
You hold this.
Very nice of Michelle.
Thank you.
Well, if Michelle doesn't have back pain now, she will.
You know, I want people to hold that for 30 seconds and work up to 2 minutes several times a day.
Yeah.
And all that pain will start to resolve. That's not easy.
That was more difficult than it looks. So what's over here?
So, you know, our spines are made of building blocks, something like this, that are stacked on top of each other. In between are discs. These discs can start to erode, and the content squishes out. Ooh. This contents then presses on the nerves and can send searing pain down our legs.
So take a look at this animation. So again, that's what your spine looks like, and those big, thick blocks in the middle.
Building blocks.
Those are the building blocks. And the little disc here in the middle, it's sort of like a Havarti cheese or tomato.
Right.
You squeeze on it and actually can get punched. You see it getting squeezed down? And that's supposed to happen. That's supposed to cushion us. That's what allows us to stand up. There's a nerve in the back coming out.
Right.
And as you start to kink the bones back and forth and you start to have a dried out disc, you'll herniate. See the little green herniation? Here's a top view, looking from the top. And it herniates up. And as that happens, it pushes on the nerve. So that nerve is coming out of the spinal column, and when it gets pinched, it's not happy, and it will shoot searing pains down your leg.
Exactly.
So how does somebody who's sitting at home watching us know whether or not their back pain is serious enough that they have to have a doctor look at it?
I want people to go to the doctor when they have pain all the time, but most of all if they start to feel weak. Those are all reasons to go to the doctor.
Right. So clue in on the weakness clue, not the pain clue. And if I can just give one bit of advice on my own, but if someone says you need surgery, especially if it's within a few months of the original injury, you need a second opinion. If that person says you need surgery, you probably need a third opinion.
I agree with that.
You agree? I mean, it's one of the last things you should be doing is running off to surgery, because when you fuse two of those bones together, or when you operate on them, you actually hinder the ability of the bones around them to be flexible. And you want the whole thing to be like a slinky.
Exactly.
Makes sense. All right, now, the third pain, so we covered headaches, we covered back pain. The third pain we're talking about today is joint pain. And I want to invite Bobby up to join me. Now, Bobby is fabulously fit. You're how old?
54.
54. She looks fantastic. Yeah. And you're apparently a big walker.
Yeah.
There's a lot of woodwork. And I'm told, actually, that you're a ballroom dancer.
Well, no, we started dancing, and that's when the pain started, but we don't do that anymore.
Were you dancing like this? Like what, attractive dancing like this?
Yes, yes.
And who was your partner?
My husband.
Where is he? Is he here?
Right here.
Now, is it his fault that your hips were hurting, or?
No. No.
All right. So there's this issue of joint pain, which I hear over and over again. It's something that I think a lot of us start to pull back from physical activity from. And I gather that you've had to make some adjustments in your lifestyle accordingly.
Well, I don't want to stop anything, so I'm just living with the pain right now.
Dr. Bond, help us understand this a little bit. What are some thoughts about osteoarthritis?
Well, you know, arthritis pain is aching pain. It is the aching you get after a long walk, or maybe when you are dancing. It is the pain that can be hurtful at rest, or sometimes when it progresses far enough, people actually wake up at night with so much aching they can't sleep.
Yeah, that's probably, I must say, that's a great clue. I've not heard that before. But the idea of being woken up from sleep is a good clue across the board, whether your pains are important or not. Right. So let me show a quick animation. Here, come join me, Bobby. So this is, again, how the hips move back and forth, and it's a spectacular joint. And I say that because the hips allow you to kink way forward and then way back as you move your leg forward and backwards. And of course that happens because you've got a ball inside of a socket. That's a mechanism for which joints work as well as carpenters make things work. If you inflame and irritate the surface area, that covering on the inside of the hip, as the bone begins to move inside of the socket, it's like taking a cut and scratching at it and carving at it. And I think that causes a lot of the pain that people have with osteoarthritis. But I think that for a lot of folks who have joint pain, that's not what's occurring in their body.
You know, if your pain is in the front of your hips and it feels like grinding, maybe arthritis, but your pain is actually different than that. Your pain is on the sides of your hips. Right. You know, Dr. Oz, we were talking about staying strong in our core and our rear end. Many times when we're not strong enough, we recruit other muscles that don't normally work. And when you have pain on the sides of your hips, it's usually due to IT band syndrome, where the tight band that connects this muscle to the knee just gets tight, tight, tight because you're asking it to work too hard.
Have you heard that before?
No.
The good news is we can strengthen our cores and our rear ends and stretch this back out.
Okay. And this is how you can keep exercising.
Exactly. I never want anybody to stop. I'm a mobility doc. You can never stop.
Yeah. All right, Dr. Wright, show us how to do this. Come on.
So Bobby's going to demonstrate for you foam rolling. This is a miracle tool that is like deep tissue massage. So what you do is you lay on the hip that hurts, and you roll this roll back and forth, and you are actually stretching the IT band, and it's a deep tissue massage you give yourself. You do it every day, and I promise you, your pain will go away.
Does it hurt doing it?
A little bit. But it feels kind of good. It's a
It's
good hurt.
It's a good pain.
It's a good hurt.
Bobby, thank you very much.
Thank you.
Michelle, appreciate it. Dr. Wright?
Thank you.
We'll be right back.
Thank you.